Welcome to the December 14th, 2020 meeting of the Yarmouth Board of Health. Please note, this is a remote participation meeting. From the top, let's go to attendance. Charlie, are you present?
Yes, he is. He's raising his hand. He is.
Mary, how about raising a hand? Bless you. Deborah?
Present.
Okay, Eric?
Present.
And Director Murphy?
Present.
Okay, welcome everyone. Let's start with public comment as usual. Hopefully we have some people showing up. Questions, comments, whatever.
I think you have Mr. Curran.
I do have one, Mr. Chair.
Okay, great. Just introduce yourself and it's all yours.
My name is Jim Cullen and I live in Yarmouth Port. And I have, I guess, two comments to make. Number one is I have, probably due to user error, been unable to narrow down the issues that we have in community spread. And I'm looking forward to Bruce's presentation later, and hopefully there will be some more specificity. My silly logic says the nursing homes are under control. The schools don't seem to be a big issue. Grocery stores aren't closing down. That leaves two places, home and restaurants. And this is same as what's happening around the Commonwealth. Just a big deal in the Globe today about the city of Medford, for example. So that is one request I have, Bruce, in your presentation. If there's a way to comment about a little bit more specificity, that would be helpful.
Mm-hmm.
Second, I know there is a Board of Health update tomorrow night at the Select Board. And if you are going to be making any recommendations at that meeting, if it would be possible for you to comment on that as well, or if you're going to have a discussion later in this meeting, because I find that the Select Board, and I understand the DHY wastewater project is mammoth, but I've been paying attention because of the school committee vacancy, and it strikes me they're spending more time discussing the school committee vacancy than the issues going on with the virus, because it's up to Dan, who speaks at the end of the meeting in the town administrator's update. And that leads me to conclude, based on what I experienced and saw you experience 6 or 7 months ago, and these numbers are far worse than they were then. And I believe the vaccine is not going to really solve the problem till well into 21. And so my plea is to become more stringent in terms of actions that might be taken. And I certainly respect how difficult a job you all have in this regard. I really do, because I don't sense you have the full support of the Select Board. And that may be wrong on my part, but that's just my observation. And that's all I'll say. And I look forward to the presentations. Thank you.
Well, first, thank you for checking in.
Sure.
Nice to hear from the public. Yeah, I think Bruce will provide a whole lot of information at this meeting. And the entire board actually will be present at the meeting tomorrow night with the Select Board. So that should help as well. However, later on, please feel free to check in and, if you want to, okay, just about our general discussion about what's going on with the virus, okay? It's not the usual format, but that would be fine. I really appreciate your participation. Okay, so why don't we start then? Bruce, number 2 here looks like a tobacco violation, and it's at the Racing Mart. It's either 16 or 14, it wasn't clear, on East Main Street in South Yarmouth. And apparently there was a sale of flavored tobacco. So perhaps you can fill us in on that. Thank you.
Yes, and I just took the phone call from the owner of the facility that I have on the phone with me now. He's having trouble getting on Zoom and the phone call, so he called me directly. It is the gas station Racing Mart right on the town line between Yarmouth and Barnstable. You have the report in the board's packet of a inspection by the county health department, their tobacco control, and they did find 2 flavored tobaccos during their inspection of December 3rd. At that time, it was Game Blue and Game Green. They were also previously on the master state list that was kept at one time of flavored. From talking to the owner that I have on the phone, it was just an oversight that they sold the flavored tobacco. He's in the process of paying the fine, and I have him right here. Now, let me just see if he's able to say anything and we can pick it up. Do you want to say anything?
Yeah.
Go ahead.
Yes, sir. I am Sayed from Racing Mart 16 East Main Street. Actually, we already sent the check to the down hall, that's the fine of 300. And the happen is this, I was living there before in New Bedford and visiting the store twice or thrice. This month, last month, I moved from there to Chicopee near Springfield. And last 3 weeks, I didn't go there. And this one has happened, unfortunately, and I apologize for this. And I will be very keep on my eyes on everything in the future and give you the assurance that inshallah you can't see any violation in future or in any time.
And that,
visit my store even tomorrow. I'm sorry for this and I apologize for this.
okay, yeah, that's correct, because it's just not a town of Yarmouth flavored tobacco regulation that we do have a regulation, but it's also a state regulation now, so that you're in violation,
Yes, sir.
so.
Excuse me, Bruce?
Go ahead. Can you hear
Yeah.
him okay, Mr. Chairman?
No, the audio is not good. So why don't you just give us a quick summary so make sure the board and the public don't miss anything. That's all.
Okay, he said it was his oversight. He does own other stores off Cape, one in Chicopee, and he's well aware of flavored tobacco cannot be sold. He's very apologetic for the violation. He did send the $300 fine into us for his first offense. And he's apologized to the board, and we'll be keeping a close eye to make sure it does not happen again.
Yes, sir.
Board members, any comments, questions?
Does it
How
say
did it
what
happen?
they found? Was it
Pardon?
one? Did they say how much was found? Was it just a couple pieces? Was it all,
Let me, do you know how much was found there?
So only I think is only 2 boxes and the total amount only 2 boxes. It's very old, left it there inside, and this one is a new guy. He didn't know about this one and he put it because he is on the training and some type of this. I was not there like last 3 weeks. I didn't go there, and this happened.
He said it was about two boxes. One of them was old.
yeah,
Um,
that's what I heard.
Yeah,
It's only like pieces like 12 or 13 pieces altogether.
so he'll keep a close eye to make sure that he only has the correct items on the store. This one violation will stay with him for 2 years. Should he get a second violation within a 2-year period before the slate is wiped clean, the violation increases, the fine increases. So it's, something that you're going to want to watch, Mr. Patel, to make sure you don't get a second violation.
Mary, did you have something?
We didn't do anything.
Okay, thank you.
I have other store in a Wareham. I have it in a Worcester. I have it here. But I told everyone, don't do this one. And I give you assurance, next time you can't see anything wrong, sir.
Okay, thank you.
Mary, did you have something to say?
I just wondered how it happened.
I think it was just, I think it was put up by it was old cigarettes that were there. I don't know where he found them, the manager that was there. It wasn't a lot that came in on a shipment from what I can understand. So it's just as a one-time thing that he's apologized for. And he'll
So
keep
somebody
a close
found
look.
them and put them up on the shelf, is that it?
He said, it sounds like that's what happened from a new manager.
So is the new manager gonna get trained?
Are you gonna be training your new manager here, Mr. Patel?
Yes, sir. Yeah, this is a new guy. He is like 3-4 weeks old only. And he put it this year. He's not a manager. He's the only employee. The manager was not there too.
All right, so you're gonna talk to whoever your managers are there to make sure that they're trained and who
Yes,
did,
sir. Manager is trained. She is with me last 2 years. She
okay,
is there.
well,
She is good. Yeah.
2 years they should know then. Who does the order, who does the ordering of the tobacco? Is it yourself?
The manager.
The manager, so,
The manager.
so
yeah.
they, so you've informed them to make sure they double check that they don't order a flavored or a center flavored. Do you give specific instructions to your retail purchasers not to send any tobacco, flavored tobacco to your store?
Yes, sir. I already do this exercise.
Okay.
I go there and check all the invoices. There is nothing.
So you check it yourself also, okay. Very good,
Yes,
no,
sir. I check the invoices.
that's fine.
Bruce, do you have the county report in front of you? Or can you bring it up on the screen?
The report?
Yeah,
Yes, I do. We have it here. Let me check to our Zoom master right here.
I just had 2 questions about it.
Okay. Okay. Here we go.
Yeah, it looks like, let's scroll down a little bit where it says there's a required state law signage posted. I think you need to go up,
Up. Keep going
and
up.
that page
Okay,
is
stop,
probably,
stop,
yep, down.
down. Just keep
That's
page
it.
2 up there.
It's
Right
probably
that's it.
there.
Stop.
There's one that says required state law signage posted, and the other was minimum legal sale age posting, and it said no next to both. So what is
Correct.
that?
He was in violation of the sign posting, and I know Phil has gone down there to talk about the posting violations, and they're in the process of getting the correct signage.
The store's been there for a while.
Correct. So we don't know if it was there or not there from the last inspection.
Mr. Bruce, I'm good now.
Just hold on one second, Mr. Patel.
Oh, great, he's on. Why don't you ask him?
You're still, yeah, Mr. Patel, you're still missing some signage that was required at the store. I believe Phil, our inspector, was down there and stated what signage you have to get up there. And I think you were gonna get some, or you were gonna bring some to the store.
You indicate these signs, what are we missing?
Yeah, you need the sign of minimum age for sale of cigarettes is 21. You need to
This
get,
one I have it up there. I
Yeah.
have it there.
yeah, well, it was checked off that that wasn't there. No smoking sign need to be posted, the minimum age 21 sign. Vaping health warning sign need to be posted also.
Oh,
So,
I will do, sir. I make it and put it there. Or I send the manager to the, or I come in the office. Is possible I come in the office in 1-2 days and take the signage and put it there?
okay, we'll work with you on getting the appropriate signs up, but that is something that, as you do in your other stores, you need to check this store to make sure the sign stays up.
Yeah, and no, my request is this, sir, if you send me some sign which I am missing, then I will be posted. Or if you want it, I make myself on my computer and post it there is good.
Okay, very good. We'll do that, and we'll work with the county health department to get you the appropriate signage.
Yeah, thank you, sir.
Okay.
Thank you.
Anyone else? Guess not. Bruce, we can move on then?
Yes, okay, thank you, Mr. Patel. We'll see you this week then. Thank you.
Thank you, sir. Thank you.
Okay,
Have a good day.
Great. Next item is a tobacco regulation discussion on tobacco cap is what it says. And there's an address, it's 444 on Route 28 West Yarmouth.
yeah.
Director Murphy, you're on.
Yes, we have the owner of that property, Jason, available with us. I think we have a letter from him. We can go past the regulation here. Let's see where we got his letter. Keep going. Keep going. Keep going. Keep going. He's the next one with kind of order. Here we go. We have a letter from Jason, who is on the meeting tonight. Has he been admitted? Let me see if he's been admitted. I know he's been on, so he'll make his presentation, but I want to make sure he hears us first. Jason, can you hear us?
I can hear you. Can you hear me?
Okay, very good. Yes, we can hear you. So just a little background. This used to be an old 7-Eleven for many number of years on Route 28, 444, Route 28. They lost their tobacco license last year. Jason, as the owner, did not buy it back from 7-Eleven at the end, which would have transferred back to him. So the license had expired. Jason had talked to the Board of Health in the end of, I think it was either December or January last year. We had talked once, and we had talked several times that he had lost his license as due to the tobacco cap that the town has. Since then, we've talked to Jason over the summer a couple times. He's had a couple people interested in renting the store. However, it's contingent on a tobacco license. What Jason's request is, the Board of Health would consider a license. There's no appeal section or variance section within the current Board of Health tobacco cap section of the tobacco license. Therefore, for any Board of Health action or consideration, the board would have to redraft the tobacco regulations to allow more tobacco stores.
Bruce, I'm sorry to interrupt. Maybe you could bring up the tobacco regulations for page 10 there, which discusses the cap and
Yeah,
town.
go backwards to page 10.
Chance for the public to see that.
Yeah, it's page 10, section Q. There you
Great,
go,
thank
right
you.
there. Oh, you went past it. Go right up. Q, right at the bottom there, tobacco cap, permit cap. So we've had a couple tobacco places go out of business and surrendered their permits. Overall permits have been decreased by a couple. I don't have that exact number, but I know a couple have been surrendered because they've gone out of business. So that is within the board's regulation, Mr. Chairman.
Thank you. So, is that Jason there?
Yes, I'm on the
Jason's
line.
on? Yeah.
Great.
Is it just a call-in or is he visual? Visual? Oh, he's there? Well.
Can you see me?
Yes. Yes,
Okay, yes, we can. Yes, we can see you, Jason. Would you like to just
Perfect.
kind of reiterate your request? You'd go down to his letter now.
I would. So good evening, Mr. Chairman and the rest of the board. So the issue was, the license was in 7-Eleven's name. And when they decided to close the store, we had agreed for them to transfer the license to me. And they ultimately decided not to, change their minds, and I think didn't want the competition. And so because it was in their name and they let it lapse, we never had the opportunity to buy the license or reinstate the license. And so because of that, the building has sat empty. We've had numerous requests from various groups wanting to open it as a convenience store. And it's still contingent upon selling tobacco. Unfortunately, the economics of convenience stores don't work without tobacco. And so I'm requesting the board if they would reinstate the license for this location. The building was custom built for a convenience store, and it would be tough to turn it into anything else at this point. All the coolers are in there. It's ready to go.
Okay, thank you. So board members, discussion, questions, comments?
I was going to ask Jason why the 7-Eleven refused to transfer the license. And my feeling was that they maybe didn't want the competition. And that seems like a bit of a problem. I mean, are they allowed to withhold the license during the sale of the property like that?
So it wasn't in the lease that they had to sell us the license at the end of the lease. The lease was drafted in the mid 1980s. And so I don't think there was a cap back then, and we just were rolling over the same lease. And, we had agreed that I was going to buy it, but dealing with 7-Eleven in Dallas can be quite difficult. And so frankly, time was running out. It was being kicked around from various people within 7-Eleven, and they ultimately decided just to let it lapse and shut it down.
Eric, does that answer your question?
It does. You know, when we head into these meetings, it's easy to go in with an idea of, okay, you know, it's not, there's a cap for a reason. And then you think about the other implications. You know, things happen, and I don't know as it's fair to have these situations created where, you know, licenses are lost, which then drives business to the few remaining license holders. So, you know, that part I think is a little bit concerning. But yeah, I mean, that answers my question.
Jason, hi, it's Deb Brunage. How long has 7-Eleven been gone from there?
They closed the store mid-December 2019. So they've been closed about 11 or so months.
Have you looked into other options for, you know, potential use of the property? Are there any other ideas of business proposals there, or simply, you know?
So we have, but unfortunately none have panned out. It would be very expensive to turn it into, let's say, an office or a restaurant. And in today's world, that's not necessarily economically viable. We had one call to turn it into a used car dealership, but nothing else from him. So I think it's a convenience store would be the highest and best use for the space.
Bruce, another question. You had said that we have had some businesses close and give up their tobacco licenses. How many do we have currently in the town active?
Approximately 30, 32.
What did we have prior to the tobacco cap?
I believe it was about 35.
It's like a 3 difference.
Correct. Right, and it's just not Yarmouth has a tobacco cap. I believe there's close to 90 towns within Massachusetts that have a cap. On this particular one, 7-Eleven and Jason knew around the beginning of that December that they needed to try to either come together and sell it or not to sell it, or look to somebody else that might wanted to buy it so they could transfer it somewhere else. So, I mean, there was a lot of discussion, and that was the decision that 7-Eleven made, that they just couldn't come to an agreement with the owner. So to me, that was, 7-Eleven's decision.
That's totally right.
Yeah, I mean, the licenses are worth a lot of money to 7-Eleven. It's not quite the same for most other people. So they could easily not sell it for the amount of money it's worth to them, I guess. I mean, they could have sold it to someone else in town with another location, I guess.
Correct. I mean, we're looking at, the board had before us the proposed Cumberland Farms up on Station Ave that the board looked at about a year ago, and they had transferred the gas tanks from one gas station over. They were looking at how they were going to get tobacco, and they were going to maybe move that from a different Cumberland Farms store. So, you know, the tobacco people that own a license know that there is a value to it, and they need to either watch it closely or decide if they wish to sell it to somebody else.
I guess where I'm at is, to what Hiller just said, 7-Eleven's a huge corporation. It's really no skin off their nose not to sell another small business license. It's easy for them. Are there any other 7-Elevens in town? In our town?
Jason?
I don't know the answer to that.
No, I do not believe so.
One thing to keep in mind is the board would have to decide, is this reinstating something? Is this granting or starting an additional license? I guess it's lifting the cap. How would another potential business owner or current one feel about if they were interested in getting a new license?
But it's not included in the current Board of Health tobacco license. So the board would have to open up their hearing on tobacco regulations and discuss if they wanted to add a number to the cap or add a variance section. It would go back up the public hearing. The last time when we had the hearing, the board had the hearing back on 2018 on this. You invited all the retail stores to come in. They came in and they were all fine with having a tobacco cap. They thought it made their stores and the license more valuable. And the two meetings that the board had, they were well represented by the retail stores that held tobacco caps. So the board would have to decide, possibly doesn't have to be tonight, but with discussion, if you wish to open up and look at the tobacco regulations again. Let me pass that comment along.
Yeah.
Yeah, Charlie's saying that might be something the board could look at, is opening up the regulation again to consideration.
If people want to do that, we can certainly put it on the agenda for the next meeting. I mean,
Well, I don't know if it would be the next meeting, Chairman, because we'd have to do some background, but it could be an upcoming meeting.
of course.
Yeah, I would love to see it on a future meeting. I mean, we offer variances for other things.
But we've also I want to let you know that we've also told other people looking at to redevelop other properties that over the last year and a half, that we did not have any license available. So other people have either moved on to a different location or have redeveloped their business into something else. So we've been enforcing this regulation for a good year and a half, 2 years now.
So the only way someone could get a license at this point is they'd have to buy it from somebody else in town.
Correct. And I know we have other people looking at buying different licenses and talking to different tobacco people right now if they're looking at selling a license.
Is there
So,
I'm sorry, Mary, go ahead.
Jason, have you looked at buying a license from somebody else?
We have tried, but we haven't found any available. So we've asked 2 brokers on the Cape to put feelers out, but it's my understanding there are none available.
Okay.
Anyone else want to put this on a future agenda? We can do that for tonight.
I move that we place this item on the agenda for a future meeting.
Second.
Sounds like we're going to vote on it. Good. Okay. A second to that. Okay,
Eric.
Eric. Thank you, Eric. Okay. So all in favor, why don't you just raise your hand and say aye.
Aye.
I assume Charlie is raising his hand.
Yes, he is.
Okay, done. Unanimous. Okay, so Jason, we'll discuss this at the board will discuss this at a future meeting.
Great.
We'll let
Thank you very
know
much, everybody. I
Yep.
appreciate your time.
Stay safe.
You too.
Okay, Bruce, we can move on to number 4, and that's the tobacco regulation discussion.
Yes.
Tobacco cap, different
Yep.
address. It's 590
Go back.
Route 28.
The letter before this one. little bit more so you can see, yes. Kind of the same question. We have a owner of and representative of the Great Island Plaza that lost their tobacco license that was revoked in 2016 for violations of sale of flavored tobacco, where they had over 700 packs of cigarettes. There was a violation. The board revoked the license. So we have the property now being looked at for redevelopment. We have the realtor here wants to talk about the board, similar thing, requesting the board consider a license. So with that, Robert, we have your letter up here. If you'd like to give a little background, that would be helpful.
No, that's great. Thank you very much, Bruce. The letter explains a lot of the background, but it's very similar to Jason's, which is we had a license before the cap. The property was kind of in a receivership scenario where the ownership at that time was not taking care of it. Tenants weren't paying rent. We know the tenants were causing trouble, and that's why they lost their license. And during that time period, obviously, we should have asked to keep that cigarette license for the site. So we've been marketing this property for a year. COVID didn't help. We had 16,569 inquiries into the property, 5,181 like requests for information, 1,202 contact informations, half a dozen different convenience stores, and at least down to about maybe 4 that walked away because of the cigarette license. The cigarette license has a value of approximately $150,000 right now, based on what we could find by who would be willing to sell them. There may be one out there, maybe just one that's interested in but it probably exceeds the value of the entire business. So we've got a over 2-acre parcel that's been in disrepair for well over 10 years. We've got interested parties to develop the site right now in hand that are requiring a cigarette license be available. I know the Board of Health is not financially motivated in any way. You shouldn't be. But this property generates about $5,000. I'm on the finance committee, so I can't help myself. But the $5,000 is all they make right now or pay right now in taxes, and this new development could push it to as much as $40,000. If we look at the Town of Yarmouth visiting statement, we do have a problem with how much commercial real estate is generating towards paying taxes. But it's not your problem, it's the town's problem. So the other things that the ownership agreed to do would be, we'd be perfectly willing to write into our lease agreements that this cigarette license, because it was only there in 2016, that it would only stay at that site. So it could not be sold off that site. It could only be transferred. So we will get away from that $150,000 value of the license and commit to keeping it at that site. If there was never a use for it at the site, we would agree to give it back. So I don't know, I'm here for questions, obviously, whatever you guys need.
What other uses have you considered?
We marketed to everything, not just convenience stores, anything retail, food, the works. Now, COVID caused a different type of issue because we couldn't do the construction where we could get tenants in the building for basically February or March. You'd like to get new tenants to launch their businesses in February or March so they can work the kinks out before the summer crowd comes. And that's for all of us. But COVID has been an issue. It's slowed us down a lot, simply because of the way we're doing meetings now. You know, look at us now, as a matter of fact, right? We just, unfortunately, old school was actually a little faster because you could lay a set of plans out, you get everybody in the same room. This takes extra meetings and longer times. But we marketed to everybody, restaurants, retail. There was no mission associated with who we were looking for. But the people that came in looking for convenience stores walked away, 4 or 5 of them, simply because they couldn't get the cigarette license. And there was no way mathematically to buy one at $150,000 and then add it to their lease, because you'd have to sell, I don't know, $10,000 worth of cigarettes a year to make up for that one license. I mean, I think the math gets impossible for retailers to buy it simply on the profit margin of cigarettes. Let's put it that way.
And none of the other interested parties panned out for other uses?
No, we did. We had it lined up. Timing, like I said, was a problem. We had ice cream, we had other uses, but I can say convenience didn't work. And the deal we have on the table right now is only contingent upon us getting a convenience store on the property. And quick math, like I don't know if I mentioned this, we're somewhere between, right now we're paying, well, we will be paying somewhere around $5,000 in taxes to the entire town. This development would raise closer to $40,000 a year if we could get it done. And I know everybody wants to see something done, obviously, Great Iron Plaza. We've all looked at it for 15 years. But that's, again, an incentive for the town, but not necessarily a Board of Health Center. My point is, we had a license. Yeah, they made a mistake in 2016, but there was no cap. So why would you apply for keeping the license when there was no cap? You wouldn't. So in 2018, that's when they probably should have applied and said, hey, we had a license. This is a 2.5 acre site. We want to develop it entirely. And unfortunately, I mean, I'm not a cigarette smoker, but unfortunately, cigarettes are necessary for a convenience store to want to put that kind of money into the site.
Bob, what other, you're going to redevelop the complex. What other stores you're going to have in there? It's just not a convenience store. You're hoping to have multiple stores, aren't you? Like a little, like a mini mall or a little walking area?
Ideally, we definitely wanted to develop an entire site much like it was. The owner is in Jerusalem. She's a Randolph-born high school student, graduate, and I'm in contact with her all the time. But because of COVID, she can't come over without, you know, staying 2 weeks in a hotel, and plus the airlines and everything else. Plus, she's older, like me, so we're not traveling in planes. We marketed to everybody, but it came clear that in order to replace the convenience store that was there, which we really wanted to do a convenience store, an ice cream place, you know, and we had it lined up very nicely. Timing was a problem. But every single convenience store walked away from replacing the other convenience store once they found out there was no cigarette license available. Oh, and by the way, we would only want one cigarette license for the entire site. We'd you know, stipulate to that too.
So even just out of curiosity, I mean, for the cigarette licenses in that location, you have one across the street, and then you have one just down the street at Cumberland Farms, 200 feet away. The business plan allows for that number of licenses for tobacco within that distance of time area?
I don't know. Is that something the Board of Health has in their records, that you cannot have too many licenses in the same area?
No.
Okay.
It's not like liquor. I'm just wondering that how that works out in the redevelopment, that's all.
You know, I don't make the math. You know, the banks do, the market does. I've been a big advocate of the fact that we all understand that housing needs help in order to create affordable housing. I got to tell you, in Yarmouth, commercial real estate needs help if you want it to revitalize those properties. It just needs help. The math isn't there. We went to several banks, and none of them would really embrace the idea of redeveloping that property. We have to come to them with the math that says as a bank, you're satisfied with what we can accomplish. We couldn't get off the ground with that on the convenience store, which was one of the anchors, a 2,000 square foot, 20% of the property was a convenience store. The rest of the properties actually were filling up pretty nicely. It's the convenience store that took the biggest hit. And we were trying to look at the biggest, when we were marketing this, we were trying to look at how to do it. We would like to have ice cream. We'd like to have a restaurant. We want a convenience store. We'd like to have a couple of service places, either eyebrows or, nails or something like that, right? We were trying to build a plaza where, with a community area for West Yarmouth. And unfortunately, like I said, 15,000 people have contacted us. We couldn't actually get anybody to sign up on a convenience store without a single cigarette license. They all walked away.
Thank you.
Other board members? I think it's important for us to just remember what the purpose of the camp was and what our responsibility is
Right.
in town, and not to lose sight of that. Eric, Charlie, any comments?
Then all I wanted to say is thank you very much for your time. If you do, in fact, had to come back, then, what you're doing is replacing the ones that we actually lost in error. You know what I mean? It admittedly was our fault for letting it go, but I wasn't there in 2016. I wasn't there in 2018 managing it. I can tell you if I was, I would have definitely said this license has significance to this site.
Okay, thank you. I appreciate your coming in, and maybe we'll just add this and this discussion at the next meeting when we discuss the cap. Okay.
Right. Yes.
Fine, Mr. Chairman. I will notify both applicants tonight of the next agenda it's on.
Yeah, so we'll have a discussion.
Okay.
Okay.
Thank you. Thank you, Bob.
Thank you very much, guys. Ladies.
Take care. Stay safe.
Good night.
Okay. Here's the item for the day, and that's the update on coronavirus. Director Murphy, you have a lot of information I know to share with us. Thank you.
Sure. Yeah, hold it on that for a second. All right, as I go into what we've been doing the last several meetings is an update on the Kroner pandemic. We'll start with some of the graphs. Let's see what we have right now. We'll go ahead. Okay. Now I got myself in the way here. You can see the graph here from when it started in March to we had the first increase there, and then it goes up to where we are now in October, November. You can see it really increasing. I don't know if that's, there we go. Then you can see the real spike heading up right now, since October, that we've had more cases in November than we did in the first 3 months of the pandemic. That what we're finding now is the community spread. And with that, I'm going to get into some numbers in a minute. But this just shows what we had for cases last Friday. Since then, I'm going to give you new updates from today, but this will just give you a feel of where we were last Friday with 399 cases. 75 were active cases within the town, 321 recovered, and 3 deaths. So that was as of Friday. The next chart, Hillard, I think you can discuss. You're familiar with this chart that you maintain for the board. So let me drop that in, and we did update that a little bit today. So you can just mention that what you see on this one.
Yeah. The weekly average, that orange line, it's that 7-day average. Back like in the first week in November, I think it was running like a 0.3. And right now we're nearing 11 cases a day. We're certainly at the point where we're seeing probably the results of the Thanksgiving holiday would be my guess of why the spike is so dramatic. But as Bruce says, just compared to most of the pandemics since March, it's pretty awful. It's terrible.
Okay, thank you, Mr. Chairman. We'll move to the next chart that, okay, go down one more. Yeah, keep going. Okay, this is as of last Friday, but I'm going to drop in. We can see there was 399 positive cases with 75 active cases I think we did this last Thursday. But let me just drop down to what we pulled up this afternoon to get a little bit more update data that I could talk about. You able to drop that in, Meredith? It still says 339. The Phil's, you're going to drop in Phil's 444.
Well, while you're doing that, the Johns Hopkins just said today that we've now gone over 300,000 deaths in the country, and 50,000 of those were just in November.
Yes. Yeah, so this chart that we just pulled right up here is based on this afternoon, probably about noontime. But you can see we've gone from 399 up to 444 cases overall, and we went up from 75 to 89 cases from last Thursday. So recovered is 350, but we've also gone up 2 deaths, so now we're at 5 deaths. And it wouldn't surprise me if we had a couple other deaths, because we do have people in the nursing homes. We also have people in hospice throughout the town also. So whether that's going to be a cause or underlying cause is something that we'll be watching. But we also looked at it by village for the community spread that Jim was asking about earlier. You can see it's pretty much spread around the community, West Yarmouth, South Yarmouth, and Yarmouthport. Probably also based on the population also, where the population is town right now. So we're looking at it as community spread. So I just want people to look at that. Next shot, we'll come back and discuss community spread a little bit more, but I want to go over the age background. Yes.
Just people need to be aware that those 89 positives, of course, that really doesn't account for all the people who are out there who are transmitting the virus. There are plenty more people who are positive. This may be far short of the people who are transmitting the virus in the community.
Oh, absolutely. And I'll mention that we're seeing that also. So the next chart right here, we kind of broke it down this is based on the last Friday numbers of 399. We could look at the age group. It was spread out throughout the community. And as I had mentioned, we're seeing a little bit more in that age group of 20 through 39. It was up into the 50-59 group, but now we're seeing a little bit more in the younger area. And that's the working force, a large majority of our working force in town in that age group. Also that age group that have children at school. So you can also see that we've picked up younger age groups within that 0 to 10 age group. We went from 14 to 16 children. And then the 19th, we went from 20 to 24 children also.
Bruce, that the total for 12/2 should be 330. On the December 2nd column, the total should be 330, not 399.
Right.
Just in case you use that tomorrow evening.
Yes, we're going to pull that one. We'll update that one. Thank you.
Okay.
All right, then you can see the breakdown, at least go off the December 10th one, the breakdown between male and female. So our you can see community spread, and I know that was Jim's question earlier. It is spread out throughout the community. And how do we sit within the town? You're right, Jen, we haven't had any big clusters in town, but recently in the last week to 10 days, we are seeing a little increase in a couple of the nursing homes. And the nursing homes under state guidelines have to get tested twice a week. And we're seeing asymptomatic people. And that's Hillard's case, that people around that didn't know they have COVID. So when we do know we had one person that was positive and they had to test out other people within the facility, asymptomatic people were becoming positive. So people in the community asymptomatic, not aware that they're passing it along.
Mr. Cullen, the one nursing home has 9, I believe, asymptomatic patients, which is pretty dramatic in that they are asymptomatic and they're in the older population. So that's
And how about the staff? What's going on with the staff?
Put it up so we can see everybody's faces.
I think they may have traced it, Mary, back to a physical therapist who may have entered the building. Generally, they are testing the staff as well. Bruce, do you know anything more about the staff?
That's correct. They're testing both staff and all residents twice a week as required by State Department of Public Health. But up until they had that positive, they were testing every 2 weeks and they had not had any cases. So they do check staff on the nursing homes and the adult living facilities. They do check staff with temperature coming in. They ask them whether they're healthy before they go to work. So I think that's the difficult, challenging part, Mr. Chairman and board members, is if people are asymptomatic, they don't know they're spreading it across the community.
Right. Part of the issue, go ahead, Mary.
I was just going to ask if they also have a protocol for testing people like a physical therapist that may visit many different facilities. You know, you have a captive staff in a long-term care facility, but how about the itinerant staff that move around? Are we certain that they are being tested? So,
And it's just not that one PT staff. There are other floor staff that go between different nursing homes within Yarmouth and out of Yarmouth.
And are they being tested?
I think that right now they're being monitored and not required to be tested unless it's picked up as part of their regular 2-week testing cycle.
So they are being tested every 2 weeks.
I believe that is the case, yes, under state guidelines.
But are we certain that that's happening?
I would have to double check with each of the nursing homes. Phil does talk to them at least once a week to see how things are going.
Well, I'm not, again, not so much concerned about the nursing homes and their staff that are in place, but about healthcare providers that may be going between facilities. And so they don't kind of have a home other than maybe the office out of which they work.
Correct. Right, because it's worker staff that could be going between facilities.
Right. And I'm just wondering if there really is a protocol or process in place to make certain that those folks are being monitored as well as the staff that are in place all the time at one facility, presumably.
So we'll take a look into that also.
Okay, thank you.
Yeah.
Bruce, can I ask a quick question? In terms of looking at those 2 charts showing the November numbers, it appeared to me that the first half of November was as active without any obvious holiday or anything like that as compared to Thanksgiving, which we're now starting to see in early December. So I thought that was kind of interesting, that what changed, in terms of causing the first 2 weeks to jump up. And then a quick question: that are the rules that you all have now more stringent, less stringent, about the same as they were in April? Are there any of those visiting restrictions or other frequency of testing? Because I know my recollection is everything was pretty well locked down back in April, and maybe not so much now. And it really seems vexing. There's got to be something here beyond Thanksgiving, in my
I think
uninformed
weather's
opinion.
part of it. Weather is part of it. People are indoors more. That's a part of it
Okay.
anyway.
So that would lead to the home kind of clustering
Correct.
type of concept. Sure. Okay, that's very helpful. Thank you.
Yeah, I mean, the weather, people coming inside, I think is the big part of it.
Yeah.
I
Okay.
think the homes, when you look at the state guideline, the state tracing, the homes is the number one by far of where the cases are getting picked up within the families.
Interesting. Early on, we weren't seeing that, which I didn't understand at all. You'd have addresses and there's only be one person testing positive. May have only been one person who was tested, but we didn't see multiple people at one location. So I think, Mary, you're probably right. People are indoors. That's part of it. Just back to the nursing home a little bit. One of the problems there is it sounds fine. Well, we're testing twice a week. The problem is there's a delay for getting the results. I think it can be 48, 72 hours before you get the results back of the tests. And that is better than it was 4 or 5 months ago, but it's still the delay before you know someone tested positive.
Right.
Is too long.
Right. And not everybody's self-quarantining during that time. If they're a close contact and they feel well, but they're getting a test because they're a close contact to a positive, they get their test and just go about their business for 3 or 4 days before they come back and find out they're positive because they were asymptomatic.
Well, and they're also supposed to be quarantining even if they get back a negative result. And I'm certain that's probably not happening most of the time.
No, and that's what we're seeing is people are not self-quarantining like they should be. They are being followed up, not as often as they probably should by the contact traces, but what we're seeing is people need to go to work. The hourly workers, people work and they don't have sick leave time, so they are going to work. Kids are going to school. We're also finding a lot of people aren't answering the phone or giving questions about where they work or not answering the tracing calls. So that's a concern. The schools, Jim, have been doing very good. We haven't had any clusters from a school. We have had several cases within the school, and that's usually from children coming home from a case that might have already been in their house, is what we've seen. As houses have more of the cases now, we're seeing that. In the lower grades, first, second, and third, the kids are spaced out in school, 6 feet apart, the desks are, everybody's wearing a mask, which is good. But sometimes when they go out to the playground, especially the younger grades, they mingle together. It's hard to keep them away. So we've had that. Teachers, we've had a couple teachers that have been close to the students, especially in the younger grades. The older grades, the teachers are able to stay their appropriate distance from the students at the front of the class. They also have a mask and supposed to be taking their own precautions also. So I'll just keep going on with a few more statistics. Let me see what we have. There's our next chart. Okay, here we go. This was based on, this is the state chart that comes out every Thursday, comes out Friday morning. This is the one that classified Yarmouth into a red high-risk community. You can see that Yarmouth also enjoyed Barnstable in red as a high-risk community, along with Harwich that was already, both of them were already high-risk communities. And you can see some of the other towns that have also moved up. They went from gray and now into yellow. Several of the other towns that are now moving up that hadn't been that far also. As we look across Yarmouth, across the bottom, that's when we're at 358 cases. That's a little lower than what we were showing because we don't match up exactly with the state right there. But overall, it does show us right here in this column right here in the last 14 days that we had 2,300, almost 2,400 people tested in the last 2 weeks. So about 1,200 people are being tested a week in town. Probably a majority of that is through the nursing homes and healthcare areas that are getting tested once or twice a week. So, you know, you can see the number of tests that we're doing. So I think that's important. I think from the cases that we're still seeing, I believe that we'll still be in a red community, high-risk community next week also.
What causes is it the percent positivity, or what causes you to change, you know, from whatever, yellow to green?
Yeah,
red?
and you're correct. It is the positivity column on the side. I don't think I have that sub chart, but once you hit 5%, you go up to the high risk category.
Okay.
And you can see that we're higher than Barnstable County itself, which is 4.3, where Yarmouth is higher than the county average, along with Harwich and Barnstable. But we're also seeing the cases kind of migrate down. We've seen Orleans have gone up. They've always been in the gray. They've gone up to green. So you've seen that go up also. And you've also seen Dennis has gone up also. So I think we're seeing some of the spread along with Brewster heading down Cape a little bit. Okay, the next chart we have. Which one? Okay, this one, it's probably hard to read and hard to read for people at home. So kind of apologize for putting so much in there. But what I did is just took that preceding chart. But I want to address your question down the bottom, Eric. Percent positivity when I'm comparing Yarmouth, Barnstable, and the state. You can see how our Yarmouth positivity has increased from when we started looking at this in August, when we were under 1%. And then we get up to November, and this is your question, Jim, we start to see an increase up to 3, 4, and 5% positivity increasing. So Yarmouth's positivity is increasing more than this, the county and the state at this time.
I'd like to make one comment about that too. The positivity rate, it is a rate. So it is the number of people who tested positive divided by the number of people who were tested during that same period of time. It doesn't have anything to do with how many people were tested, you know, that more people are being tested, because it is a rate. It's not just a number.
Correct. And we're also seeing more people, as we see more people being tested also, but we're also seeing more people with illness.
Right. I mean, you've heard this enough in the news that the rates are going up because they're testing more. Of course, there are more cases that we find, but that's not really the important. It's really the percentages that we're looking at. Right. Positivity is really what it's about, I think.
And I mentioned that because,
I'm sorry.
Oh, I'm sorry. I was going to say I mentioned that because, you know, just a little bit further on, we have a copy of an email from Eric Tolley, and I think he didn't understand that point about the positivity rate.
Right. That I'm sure will come up tomorrow night.
Yeah.
Yes.
Okay. Thank you.
Is contact tracing going okay? Because theoretically, if you do more testing, you need to have more contact tracing. Is that going effectively in your eyes, Bruce?
Right now, I think between the Cape and in Massachusetts, it's getting swamped with the number of cases are outpacing the contact traces, and they're not getting to them as quick as they should. So I think that is.
And that's the big risk. That's the downside to more testing.
Well, that's it. And I think the question is like the chairman mentioned, it takes a couple of days to get results back. So if somebody's not feeling well, it might take them a couple of days to get a test. Then it takes 3-4 days to get the results. So
thank you.
It takes a while. So some of the precautions that, that people can
Is what
take
it
that
is.
we've kind of mentioned before is avoid large gatherings, dinner parties, birthday parties, sleepovers, play dates, people not wearing masks, carpooling if you're not with the family members. It's how do you spread it if you're not in your home, or if you're waiting for a test results, you shouldn't be going to work or going to school. You should be staying at home, because we've had several cases between here and Barnstable and talking to other Cape Towns where people have been waiting for a test and have just gone and then found out they're asymptomatic and has spread it into a different area. Okay, next.
Mr. Cullen, just one comment is that, you know, Bruce and I here, when we're on our state meetings, the contact tracing collaborative is hiring. There are training programs for a week.
Yes.
We're looking for more people. I think it started out that way, you know, 4 or 5 months ago, and I guess the rates weren't high enough to keep everyone on board. So they are looking for people.
That's correct. In August, when everybody was outside and we went 21 days without a case, there wasn't as much of a need for the state contact traces. So a lot of them were let go. And now that we're inside and we're seeing a spike, they're getting the people back to work to see where this might trace back to.
You know, one of the downsides is you have to have a desktop. You can't use a tablet or a Chromebook.
Yeah.
I said goodbye to my desktop a couple of years ago.
Yeah.
I was going to look into it, but you know, it says you must have a desktop, and I'm not going to invest that money at this stage.
Yeah. So we do have the schools help us out. Their school nurse we stay in touch with almost daily. If we see a case come in, I know Phil works over the weekend, just keeping an eye on cases coming in. So that if we see a young person come in, we call the school nurse right away, and she can see if it's in a class, and we can take action on a weekend, so we don't have to wait to Monday to if we have to pull a few students out. So that's important, keeping an eye on it over the weekend. What we see have Governor's Baker Order 57 that came out Friday, that became effective Sunday, which kind of rolled back everybody in the state, just not if you were a red high-risk community. Everybody rolled back to what the governor had labeled as phase 3, step 1, which was putting restrictions on outdoor gatherings to 50 people, indoor gatherings to no more than 50, reducing capacities in some of the stores from 50 to 40%. Gyms have to wear their face mask at all times, even if they're in the cardio area. Restaurants, they decreased the seating from 10 to 6 per table, with a total limit of 90 minutes within the restaurant, and no musical performances within the restaurant. So this notice we did get out to the businesses in town. The Chamber of Commerce posted it. It went out that way. It was also sent out to the town, to all liquor stores. Licensed people did receive it. And we did call a few other locations also. I did visit the health clubs in town and call them, so they were aware of it. I did stop at our large grocery stores. You'll see those doing counter check of people coming in now, especially during the high peak times. So I think the message is out there, and I think people hopefully take heed. We've placed a few more signs up around town at the Homer's Park about social distancing. And we've also placed another one up at the landfill. Has made a nice sign as you drive in that's visible. Okay, the next item I guess we can go right into on the agenda, Mr. Chairman, is the availability of the upcoming vaccine distribution that I'm sure everybody's anxious on. If you want to go over that, or I can mention what we see.
Yeah, go ahead. Thank you.
Okay. the vaccine distribution is really being set by the federal government, who's delegating it to each state to determine how they shall issue the vaccine. So Governor Baker has come up with the attached guidelines. You want to go down one more page. Keep going. There we go. Phase one is what everybody's hearing right now. That's kind of the vaccine that's coming out in December is going to healthcare workers in the hospital. And this vaccine's going straight to the hospital. So that's where the first round is going. And then after the hospital workers, it goes into the long-term care facilities, rest homes, and assisted living facilities. First responders of police, fire, and EMS services, congregate care settings, home-based healthcare workers, and healthcare workers facing COVID. So that's the first phase that you're going to see in December to February. And then the next phase, as vaccine becomes available, and most of this is a 2-shot vaccine, so it's not like they can give out all the doses at once. So then as they get into February, as more doses become available, it's going to be individuals with in the high risk with complications. Then they look at teachers, grocery stores, agricultural, sanitation, public works, public health workers, adults over 65 will be looked at. And then they're hoping by phase 3, which will probably, they're saying is April, May, will be for the general public. So I think we'll be keeping this will be keeping modified as the number of vaccines become available. Because I know we're still getting calls at the health department when we're going to be sponsoring a clinic. I think what you're going to see for some clinics will be the pharmacies have contracts to issue it. So I think that's the way it will go. Whether there'll be a large clinic set up like they're doing testing sites is being discussed now at the county level and state levels also. So I think that's the general overview of that, Mr. Chairman.
Okay, number 7 there, looks like we've had some complaints.
Yes, we're still receiving some complaints. Don't put that one up yet. You can go back to showing us. Still getting complaints in stores in general. Either people working in the stores not wearing masks, or people coming in without masks, or people in a store too close together. So we're still responding to people when they call in of what we're doing to go out and investigate a couple places. So various staff members are going out doing that.
Thank you. I know it takes a lot of time.
Yes, it does. Yes, it does. Okay, do we have the flu clinic one? That's not in there. Okay. I think that's all we have covered right now. We still have flu shots available at the, oh, here we go. Yep, flu shots are available that with partnerships with Cape Cod Hospital. We can show that one right up here. That anybody that's still looking for a flu shot, they can go to their local pharmacy. And they can also check with Cape Cod Healthcare that's providing it also. So that wraps up the meeting, Mr. Chairman. I will just end with, I will schedule a meeting probably after the first of the year, and I'll talk to you about scheduling how we want to handle discussion of the tobacco cap. But I would like to say that we're doing additional education to the public by sending a robocall out, just saying what the status is that people want to know. And the last 2 weeks, I've done a short video of what the stats are to get up on our town website and YouTube. And I've also interviewed a person at the library director and senior center director to have what the effect on the library and the seniors are and what they're still doing to be safe. So if you would like, Mr. Chairman, I can show that short video now.
Well, it was his second career as a film director. We certainly want to see your second piece. So
Well,
let's
the
take a
second
look.
piece, I gotta say, it all goes to Meredith, that's Zoom master here, that we found another highly talented area of her for production, that she's terrific and spicing things together and making it all look good.
We have one opening for special effects, if anyone can help out next week. Okay.
All right, let's see if we can call that up now. No, it's not going.
Yeah, we need to correct that one page. Good, can you see everybody?
Can everyone else hear this? I was gonna say, I can't hear it either. I wanted to make sure it was just me.
Can you unmute Hillary? Hillary, can you hear it? Can you up? Can you?
I was gonna say, I can't hear it either. I wanted to make sure it was just me.
Is Hillary unmuted?
Can any other board member hear it?
Yep.
Yeah.
Nope.
Say good night, Dick.
What did Eric say? No? Well,
I would say if nobody else can hear it, we'll pull this off and see if we get it is up on the town website,
Okay.
and we'll work on, let's stop this right now. Is it stopped now, Meredith? We'll jump back to our meeting. All right, well, we could hear it earlier, so what we'll do is we'll work on that. However, they are playing at the top of every hour on channel 18. And we also have it up on YouTube, the town YouTube site. So the second part of that video that it was just going to go into was my discussion with the director up at the senior center. Diane Kane. So this week, we're hoping to meet with the food pantry to discuss the what's happened over at the food pantry and the increased number of people they're seeing there. And they're also looking for donations at that. So I know I sent the board members the link. Meredith sent out a board link to everybody, so you should be able to see that yourself. And we're going to try to get that out to the community as much as we can.
Great, thank you. Anyone else with any new or old business? If not,
I just had one thing. I know we're posting a lot of resources. I've watched both your videos, Bruce, they were awesome. And what I haven't seen a lot of is any kind of mental health resources, either on the town website, and maybe I've missed it. But my husband and I were talking, and he was saying how he works for Barnstable school system. And they were, he was talking to someone about there's been a real large increase in referrals from pediatricians to mental health resources for the kids and the remote schooling and all of that. And I was just wondering, as a board, if there were some sort of resources, mental health wise, that we'd be able to either share on the Channel 18 site or share on our town website.
Yes, we can look into that. I know there's a couple sites that are available through the county, state, and local phone numbers that we can add to Channel 18 in our presentations.
yeah, including issues with domestic violence, which is up unfortunately as well. Okay, Bruce and I, we can talk about that. We'll see what we can get on the town website.
Terrific, thank you.
Good.
Anyone else? New or
Yes.
old? Great.
Can you hear me?
Yes.
Okay, I just wanted to comment on an article that was in the December 10th Register about the setbacks to the restaurant industry. And there was a quote in here from the owner of Captain Parker's, who said, "Throughout the year and the many changes, Yarmouth town officials were excellent to work with." And I'm certain that that must have meant Bruce and his crew. So I think that was a nice comment on dealing with difficult issues with the restaurant folks. The other thing was in the December 9th Boston Globe, a survey suggesting a support amongst people for more stringent limits, which I thought was very interesting. People that were surveyed, by and large, favored more limits. And this was before the December 13th limits that our own governor put in place. The other poll that was done found that most in Massachusetts were open to the vaccine, which I found very encouraging too.
Thank you. If that's it, someone can make the motion and we can move on.
Well, one question, are we going to talk about the Board of Selectmen meeting tomorrow or not?
Yes.
Certainly.
It was on the agenda, so
What time are we on? Does it say what time we're on for? They were trying to get us at the beginning of the agenda. I'll have to, pardon? 6:30, we're on the agenda for it. Starts at 6, they have us on towards the beginning. So 6:30,
Is it Zoom or in person?
Zoom.
Oh, and you'll send us the link?
We can send you the link. It's also on the town website, but we can send you the link on that.
Great, thank you.
Appreciate if everyone just maybe going a little earlier by chance if they're ahead of schedule, if something like that. Usually they're not, but it'd be helpful. And when you don't have to stay for the whole meeting, okay? They go on a long time, but just for the part with dealing with the pandemic, I really appreciate everyone showing. Thank you.
and what kind of report are we going to give them?
We do
Or
have,
are you and Bruce going to give them?
yeah, well, it'll be Hillard and myself. We do have the stats that we'll update from today. We'll talk about this, where we are in a high-risk community, what other steps that might be able to, the town could undertake, and what we've done so far for general education.
So what other steps can the town take? We're supporting, I presume, the town manager's recommendation that the town facilities be closed?
Paused at this time from the public coming in. The town
Right.
staff would still be working, and we're
Right.
doing so much on by computer and the website now that that's working very well. We'll just cut back on the public hours.
So what other recommendations?
Well, I think that's the big one. I think going to the library curbside pickup was a very positive. I think that's probably the two big ones right there. I think keeping the sign postage in town, and I think keeping information up on channel 18 is very important, and YouTube to get it out on the town's social media information.
So we're not planning on any more recommendations at this time.
At this time, I think we're just following the new governor's orders that came out Friday and effective Sunday. At this time, I think are probably sufficient, but we'll continue to monitor them.
Barry, did you have some specific instructions? It's been a while since we addressed it. Obviously, we ran into some problems trying to coordinate efforts with the select board.
Right. I thought it was kind of disappointing that we're still not being included in the loop. I mean, the memo from the letter from Dan went to the select board. It was copied to Bruce, but there's just something still not right with the communication, I think. And so I, for one, if I'm going to be representing the Board of Health, along with the rest of the members at the meeting tomorrow evening, wanted to be certain that I understood what you all were going to be reporting, any recommendations you were going to be making, because we, of course, can make more strict recommendations if we wish as a local Board of Health. The governor made that very clear in his address last week when he announced the new limitations.
Mary, do you have anything you wanted to say, or of anything?
No.
Anything
No, I don't
specific?
I don't have any specific recommendations for anything more strict than that, but I just think, this is such an important issue. I mean, we've got 5 deaths now. That's all I wanted to say.
Yeah, it's been a problem. As I said publicly, I've reached out and really haven't got much of a response to try to coordinate our efforts, and I'll try again tomorrow night.
Okay, thank you.
Anyone else before we close up?
I'll make a motion to adjourn. Charlie's making a motion to adjourn.
A second.
Okay, just raise your hand, say aye if you want to leave.
Aye.
That's it. Meeting's adjourned. Thank you. Stay safe, everyone.
You too.
Right.
Thank you. Good night.
Night.